So for you who's gonna watch later or now, you can also see what we do behind the scenes for our content creation. Here's Amir.
Hey guys, how are you?
And he's helping me with these videos. I'm just gonna wait for a couple more people to join us. All right.
Waiting.
Huh?
Just gonna put the mic on you.
Oh, okay. And I don't know if I should leave this here or leave it there. Okay, that's fine. That's fine, yeah, that's better. Because it's a bit more of, you can see more of the clinic. So for whoever just joined, we are doing some content creation, we are doing some videos for our YouTube, but I'm gonna have you live, so if you have any questions, you can comment below and later on we can answer them. The topics that we're going to talk about, we are going to do one root canal video, so about root canals because I realized I've never done one, dental cleaning, dental fillings, and then if you have time, dental crowns. If you have any questions, pop them below. Don't forget to press that like button because that matters so much. First one, root canal treatment. Shall I tell the guys to shush or it's alright?
That's fine.
Okay. There's a mayhem going on the side. Everybody's happy. It's going around.
I'm just gonna bring the camera a little bit down.
Shall I go down a bit?
Yeah, that's good.
Ready? Okay. Hang on. Just stop. What to say about root canal treatment? So root canal treatment, why it starts? First we have to talk about why you would be recommended to have a root canal treatment, and then I explain step by step and then the risks. Yeah? Okay.
Let's start with something catchy first. Okay.
Alright.
Catchy sentence at the beginning.
Okay, alright. Alright.
Ready?
Do root canal treatments actually work? Now, you might have been recommended by your dental professional that a tooth you have needs a root canal treatment. There is a good chance that that tooth has pain and that's why you have been recommended to do a root canal. It's not something you would want to do. Usually people say, I don't want to do a root canal treatment, nobody wants it. But it's a treatment you might need and it can save you from pain, infection, it can save your tooth there. But why would you be recommended to have a root canal treatment in the first place? First of all, the only reason that you would need to do a root canal is that there is an infection inside the root of the tooth. The name suggests that, right? So how does this happen? Usually, not always. You got a cavity in the tooth, it has not been treated, and that cavity got bigger and bigger. The bacteria inside that cavity basically uses your tooth as a source of food and energy. Yum yum, they use your tooth, and their byproduct, basically when the bacteria go to the bathroom, they produce acid. The acid will dissolve the tooth structure because our teeth are made of minerals and they become demineralized. So the acid will dissolve the tooth structure, leaving behind soft, gooey tooth structure, which is not useful. But this also helps the bacteria grow, so they colonize over there and they become more and more, and then eventually they go deeper and deeper into the tooth. You have layers of the tooth to pass before you reach the nerve of the tooth. First layer is your enamel, the one you see from the outside, these. Second layer, a couple of millimeters deeper, is your dentine. Dentine usually has sensors, so usually you should be able to feel something, sometimes to sweet, sometimes to cold and hot temperature. But sometimes you don't feel anything because your teeth don't have as strong nerves, or their nerves are much deeper, stuff like that. People have different threshold of pain and sensitivity. So if you don't do anything about this cavity that keeps growing, it goes deeper and deeper, and eventually it's going to reach the nerve of the tooth. The nerve of the tooth lives inside a pulp chamber. There's a little chamber, imagine a little room inside your tooth that holds the blood vessels and nerves. So many of us think that our teeth are just dead objects inside the mouth. That's why we don't really think that this is connected to our whole body via our bloodstream. If it's ill, if it has infection, it can literally go everywhere. It could eventually cause death. As if you Google, you can see that some people, even recently there was a famous person who died because of a dental infection. Now, it might not be that common, but why risk it? So this chamber or room has the nerves and blood vessels of your teeth. The infection is getting closer and closer. You might start feeling pain, and eventually when the bacteria enters the room and infects the nerve will send the signals to your brain that we have pain, inflammation. This pain usually becomes unbearable. People describe it as throbbing, or they cannot sleep at night. It gets worse when you go to bed because all the blood rushes to your head. And also, it doesn't stop by taking painkillers, although it sometimes gets better. Wrongly so, sometimes you are prescribed antibiotics, or you might, people come to me and say, just write me an antibiotic. Or people come to me and say, last time my dentist gave me antibiotic and the pain stopped, why can't you do it? And of course I can. And by law, I can, especially if you have systemic signs of this infection or inflammation. For example, you have fever, you cannot sleep at night, stuff like that. But antibiotic is not the only answer to your problem. Because if I give you antibiotic and painkillers and help you for a couple of days and kill the symptom, that infection is still growing. It does not go away. It's not like the rest of your body that you sometimes can treat the infection only by antibiotics. You're basically only making your body resistant to antibiotics. Now, why is it like that? Why does the infection doesn't go away? Now, why is it like that? Why is the infection like that and it doesn't go away by antibiotics? Because it's in a bony cavity. Because it's in a bony cavity. Basically, the infection got to the enamel, got to the dentine, got to the pulp chamber, went down, 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 down from the root and got to the bone of your jaws. And aged through the bone, created a granuloma, a cyst, basically a little room for itself inside your bone, full of infection. Bacteria is partying there. This cavity gets bigger and bigger. And then the infection can spread from one side to another because our face is made of spaces between fascia, which is your skin, muscles, and the bone. So if it reaches one of these spaces, basically these spaces are like hallways between the rooms. So it can go from this side to that side. You get fat face or big face. You wake up suddenly with a swollen eye, even it can go from the upper teeth. So each tooth is connected to a different fascia space, and each space can radiate that infection to different parts of our body. Keep in mind that it can eventually go to your brain or your heart and cause death. Now, as I said, it is rare, but it happens. So what we want to do, first thing first, good oral hygiene. Prevent the cavity. Good oral hygiene comes from flossing, brushing, and seeing your dental professional once every 6 months. Why do you need to see the dentist or dental professional once every 6 months? Because there are problems going on in your teeth. Because there are problems going on in your mouth and your teeth that you might not be aware of, because they're going to give you pain when it's too late. When you already need a root canal, when you already lost the tooth, when the infection already spreading everywhere. So what you want to do is somebody else look in there and say, oh, by the way, there is a black thing there, let's take an x-ray, right? Every 6 months get a check. Every year, every 2 years, get dental x-rays done. And stop the problem when it's much, much smaller. If it already happened, so let's say it's too late now, I have an infection inside the tooth, or even if it has spread to my bone, there is a cyst there, there is a granuloma there, and I have pain. There is a cyst there, there is a granuloma there, and I have pain, and my dentist has recommended a root canal treatment. What are my options? The first option is the root canal treatment itself, and how it's done is your dental professional will remove the cavity first, clean it, clean the nerve, dry the nerve canal, put in a root filling, put in a tooth filling, and then hopefully most of the times it will kill the pain unless we have missed something, which can happen because the treatment is very complex. The second option is to pull out the tooth altogether. For example, if this happens to a wisdom tooth, my recommendation usually is to take the tooth out. Now keep in mind I have to first examine the patient. I cannot give you one size fits all for all the treatments you need. But in general, removing the wisdom tooth would be recommended because usually you don't need that tooth and it's causing a lot of problems, and doing a root canal on a wisdom tooth, not only it's difficult, it might not be the best treatment that we can do because it's really, really at the back of your mouth. But sometimes we need to keep the tooth, so that is the only option. So your options as a person who has infection inside the tooth is root canal treatment or pull out the tooth. And the third option that you have to give you is do nothing, but it is not recommended. At some point, this infection will kill the tooth completely and the pain will stop. But the infection is growing silently in your body, making you feel ill, lethargic maybe. You are not happy anymore. You know, it can affect a lot of your moods. And as I explained before, the infection can spread to your body.
I think that was the longest monologue you've ever done.
I honestly think being live made me stressed out and I thought I was better. Let's see. Good morning from Yipma Bariuya YouTube channel. Oh, nice. Why did it disappear? I lost the comment. Guys, thank you so much for watching. I'm still here, but yeah, having you watch I think stressed me, and I was better at I was better at the video. We should do this all the time. I'm just fast. I'm like, oh my god, so many people are watching live.
Next video.
Don't forget to like the video while you're watching. It really helps us. Okay, so I explained everything. I explained it step by step. The risks of root canal are so much that I won't get them in one video.
Do you wanna mention the aftercare as well, or that's too much?
It's kind of risky because the dentist has to. I could explain that when you have a root canal treatment, it doesn't mean that the tooth is dead and you can treat it any way you want. You still have to have it clean. Okay. If you have any questions, comment below because I'll come and check them out and reply.
Ready?
No, I forgot. Alright. Now, let's say you had a root canal treatment a couple of years ago, the tooth is fine. Doesn't mean that the tooth is dead, so I don't need to take care of it. No. The tooth is still a source of food for bacteria. So you still need to get your checkups done, regularly, as I said, every 6 months. You need to floss and brush and keep it healthy. The biggest risk with the root canal treatments is that because we drill a lot of the tooth out, and we have to, there has been a cavity and most of the tooth structure is dissolved. Even if we don't clean it out, it's going to just get worse. So we clean the area out. Because you've lost so much of the tooth structure, there is a very good chance that the top of the tooth breaks. That's why most dentists would recommend to have a crown placed on the surface of the tooth to hold it together. If you want to know more about crowns, have a look at the video that I'm going to tag above, and it will explain for you what crowns are. Thank you so much for watching. I'll see you at my next video. Okay, this was really fast. If you have any questions, guys, comment below. Now, we did the root canal. Super proud of ourselves. The next one is a clean. Now, do you want?
Do you want to do like a short form of the root canal as well for Instagram?
It is difficult.
Like in 90 seconds, can you say anything about it?
No, I mean, you know how we did it last time?
I know.
It's just difficult to post it at the same time, remember? And then what I realized, in between platforms, people don't want to jump. Like, they don't care. Unless you put the link in the story, they can click on it. They're not going to close the app and go back to another app.
Oh, okay. Yeah. Or maybe you can just give an overview of what the root canal is.
Do you want to make two versions of this? One short, one long?
Exactly.
Yeah? And then just add below that for a longer version of this, have a look at it. Yeah, that's best. I'm just going to have a glass. You want some?
No.
Hey guys, if you've joined us recently, we are doing videos for our YouTube content. I've already done the root canal treatment. It'll be up on our YouTube soon, but I'm gonna post this live later on anyways. If you have any questions about any of these, please comment below because I'm gonna have a check every now and then and respond. That's the whole point of this live. If you like what we're doing, give us a thumbs up on this same video you're watching because it really helps us. Could you, I don't know where the comments go because I saw some comments and they disappeared. I didn't want to just move. Oh my god.
These are all the changes.
How did you do that?
So you have to go to this and then put live chat or top chat here.
Okay, alright, okay. Good morning. There has been some good mornings. I'm watching your show from Barbados. What causes bone decay? Bone decay. First of all, thank you so much for watching from Barbados. I'll explain the bone decay in a second. So, not a bone decay, but basically, it's like a cyst, right? It happens because the infection goes from the tooth down underneath. There's a canal inside the tooth that connects the tooth to the bone. So it goes down, and then where does the infection go? It will create a cyst, like a hole in the bone full of infection, and it keeps producing because they're colonizing there. And then eventually it will try to get out of the bone by the path of least resistance. So for example, if there is an infection over here on top of my canine tooth, it will try to come out from this bone because it's the thinnest bone rather than going inside my throat. Now I can't predict it, it can go anywhere, but it's in general not recommended to keep the infection in your mouth, of course.
Behind the scene, I'll put behind the scene.
I know. Can you?
Thank you.
Alright, the next video should be about the dental cleaning, which is always a hot topic because almost everyone needs it. I think a couple of myths is good to talk about dental clean. One would be does cleaning scratch my enamel? How often? And it creates gaps. These are the things that people mistakenly think about. If you have any questions, comment below. If you like what we are doing, give us a thumbs up because it's right up there. Did you give us a thumbs up? Hey, I need the
I'm gonna
line.
message the group chat. Everyone can. Oh, sorry, I'm not even subscribed to your channel.
Shame on you. Our own social media manager is not subscribed to our channel. How much of a shame? Look at this person.
I am.
Shameful.
See,
Now only. Too late. Alright. I still have to learn how to work with this gimbal. Alright. Next one's the dental clean. Let's go.
Here, fix it back.
mean, this is not going to be as fast as the other one because it's spread. It's about, so I have to talk about basically, hi Martinez from Studico, watching your show. Hey Martinez, thanks for watching. Let me find out more questions.
Just gonna ask everyone to say where they're from.
Oh yeah. Hey everyone, yeah, that's a good idea. Put down where you're from in the comments because it's interesting to see who's watching and with what time zone. Sorry, I'm trying to go to find out more common questions about dental cleaning. All right, that's best. Okay, we have some common questions now. Okay, that's good. And I can have a look every now and then here. How long does the dental cleaning take? What's the difference between scale and quality? All right. Yeah, that's good. What?
That's good actually. Yeah, that's okay. Ready?
Let's talk about some. Let's talk about some myths when it comes to dental scaling and cleaning. I think the biggest one for me is when people ask me if scaling is going to scratch their enamel, and it doesn't. Sometimes they even say, oh, the last time I had it cleaned, I had my tooth broken. You have to remember that the scaler works with ultrasound. So it's basically vibrating only. It cannot physically drill into your tooth. So a dental scaling and cleaning cannot break your tooth, create gaps, or scratch your enamel if done correctly. And believe me, I would say anybody who is a registered dental professional would do it correctly because it's the simplest thing that they will teach us in universities. So I have to do this slowly because otherwise I'll mix up. And the second thing is that people say when I do cleaning, I get gaps between my teeth. The second one, and an interesting one, is when people say, I don't do a dental clean because it creates gaps between my teeth. You have to think of it this way. Those gaps either already existed between your teeth, so you generally had gappy, smile, teeth were a bit separated, which means you need to, if you want to bring them together, you have to talk to your dentist or orthodontist and use orthodontic treatments such as braces or Invisalign. Keeping calculus, buildup, germs, bacteria as a covering between your teeth is absolutely not advised, and to be fair, it's a little bit gross and non-hygienic. Secondly, maybe you didn't have those gaps, but you say, the first time I did a clean, it created a huge gap between my teeth, that's why I don't do a clean anymore. And believe me, this is a very valid question, it's so common, I hear it all the time. But why did dental cleaning create a gap between your teeth? How is that even possible? Did the dentist drill out a part of your gum or tooth or bone with dental cleaning? No. As I explained, the dental scaler or cleaning cannot create gaps between your teeth. Those gaps were created because you had so much germs and bacteria. It was first soft, created some plaque, then it hardened and calcified and had calculus in between your teeth. That calculus started eating through your bone to to put it in layman's term, and created a space between your gums and your tooth and filled that space with calculus and bad stuff. Basically, it has caused gum recession. Your gums gone down, created a gap, that gap is filled with calculus. So the first mistake was to have the dental cleaning way too late in your life. That's why you have that gap. Now, not cleaning it because that calculus makes it look nicer is absolutely wrong. You have to clean it because this is just gonna get worse. I've had a patient recently who asked me when I'm cleaning not to remove the big calculus between the two front lower teeth because she's going to a wedding and she doesn't want the gap to show. I understand the need to look nice and presentable, and the fact that you think that at least it's the same color as my teeth, you know, it's a bit yellow, but it's fine, better than a big chunk of gap. But remember, that's just creating the gap more. You are creating a bigger and bigger gap by not getting it cleaned done. So have a clean, make sure your gums are healthy. If you need to see a gum specialist, do so, and at least it will prevent the gap from getting bigger. To close the gap, talk to your dentist about the options that you have. Alright. Guys, if you have any questions, comment below. I'm gonna check the comments every now and then so people don't get bored. No, I've answered all. Alright, what else? How often should I get? How long is this, by the way? Can you tell me? Because I want them each to be about 5 minutes.
It's 3 minutes so far.
But what about the last one? Both of
The
them?
previous one?
No, I mean, I did it 2
Oh,
minutes.
no. Together.
Is 3 minutes? Okay, another
Both 3 minutes.
2 minutes then. Can dental cleaning prevent gum disease? Okay. And how often do I need a dental cleaning? Can dental cleaning prevent gum disease? It absolutely can. It's so easy. The germs from food and bacteria and our own natural good germs in the mouth all together create a pellicle and a plaque, soft deposit on your tooth surface. If you disturb that plaque, which is like a little ecosystem on its own, every 12 hours by brushing your teeth, basically it cannot grow further and further. But there are areas that you cannot clean properly, especially if you have crowding in your teeth. So that's when you have to every 6 months get it cleaned on to make sure you are disturbing that ecosystem, that biofilm, that calculus. And 6 months later, usually it comes back. Now, some people need it sooner. I have people who I have to ask my patient to come back every 3 months because they have active gum disease. Sometimes I cannot manage it and I have to send them to a periodontist who's a gum specialist. Or sometimes they only need it once every 6 months to a year. So each person's mouth and also what they eat and genetics will determine how often you need a dental cleaning. Something like that. How long?
1.5.
Okay. Crowding.
We can leave some stuff for the next.
I know, but
it
it hasn't been 5 minutes, has it?
It's okay as long as it's over 4 minutes.
It's fine?
Yeah.
So do you want me to do a separate one now?
Yeah.
Okay.
Leave something.
How do you know that this is going to be the next one when you're editing? Oh, I can ask, like I can say the title, then you will remember, right?
I can't remember the number of the video.
Or do you want, let's do one short video, so I say now we are going to the next video, so you will see it and remember.
Okay.
Amir, this is for you. Now we are going to the next video. Thanks. Pause it. I don't remember what to say. Alright, wow. This is hard.
You can check the comments as well. Leave in your comments.
Guys, comment below where you're from, where you're watching us from, and give us a thumbs up.
I know it's morning in Australia and night pretty much everywhere
Is
in the
it?
world,
Or
yeah.
asleep?
But whoever is awake, comment here. Let us know where you're from. Adrian from Barbados.
Yeah.
What are you doing in life? What's the beach? I want to be in Barbados.
Yeah. It's nighttime. Sleeping time.
Is it?
I guess. Okay, I don't know what the title should be, but you can help me with the next title. So, I always tell my patients they get more calculus or build up when their teeth are crowded, and when they straighten it, they can clean it better.
So they get less calculus if they straighten it.
Yeah, basically, yeah, because they can clean better.
Okay. How straightening your teeth can help you
Your oral health.
your oral health.
Okay. How does straightening your teeth? What?
Whenever I say so.
How does straightening your teeth give you a better oral health and gum health? So basically, I always tell my patients this, and this is going to explain it all. It's easier to clean your teeth at home when they're like this rather than like this. When your teeth are all smooshed up and crowded, you cannot get in between and clean them. I do sometimes struggle myself when the two teeth are so rotated toward each other. I cannot get in. I can see there is still build up there to clean. But I can't for the life of me get in there and clean it. And we use so many different tools, finally get it out. But it's so easy for your teeth to get the most build up in between each other when they are rotated, and they're basically, your teeth should be next to each other like this, right? So they're only touching half a millimeter. When they're like this, they're touching 5 millimeters. There is 5 millimeters for you to clean. It's tight, you cannot get in, the dentist cannot see it properly, we might miss stuff, and eventually that tooth can get gum recession, can have a big hole in between, and we won't even see it until it's too late. So always aligning and straightening your teeth. So usually people come to me to align and straighten their teeth because it is for the cosmetic reasons, it's nicer, but remember that it actually is for your oral health, and the cosmetic side is just a bonus. Okay, that's all. How long was this?
That was a minute and a half.
I have nothing else to say. Guys, if you have any questions, comment below. If you don't, press the like buttons. It really helps us. And I can see only 3 likes so far.
Don't forget to subscribe
Yeah.
if you're not.
Like,
We can make this a short form if you want. If it's
yeah,
short.
but it's really long. Okay, that was one.
Or so we can add more.
Oh, here? Oh, okay. Add more, please. Is dental cleaning necessary if I brush and floss regularly? That's such a good question. Okay. Good? Is dental cleaning necessary if I brush and floss regularly? Yes. Now, why is that? Because there are things you cannot see to remove at home. Simple as that. I'm a dentist, I work in a dentistry, I still get the scale and clean them. Now, to be honest with you, I don't need it as often as most other people. I don't know why. It's usually your genetics, what you eat, your diet, how straight your teeth are. So if you have good straight teeth, you have amazing genes, you know, and your diet is in a way that it doesn't cause a lot of deposits, you get the least calculus, but you still will get them. There is not a person in the world that I would say they don't need a dental clean. They just might need it more far apart. You still need you still need to have a check every 6 months to make sure if there is a cavity, God forbid if there is any cancerous lesion, and also do you need to have a clean done or not. But if you floss at home properly, if you brush amazingly, you still will need the dental cleaning to get rid of those big chunks of calculus that you cannot see. Sometimes they're under the gum. They're called subgingival, as in sub, under, and gingival, gum. You can't see that, but the dentist or the gum specialist or the hygienist can. Alright, that was a good question. Guys, if you have any questions, comment below. whiten my teeth? That's such a good question too.
Wait, okay.
Can dental cleaning whiten my teeth? Now it's hard to answer this because it depends on how much stains are on your teeth. So if you have a lot of black stains on your teeth and I do a clean for you, yes, it looks like I've done teeth whitening. But teeth whitening is so different from dental cleaning. In general, dental cleaning is to remove the germs, the bacteria, the big calculus, and tartar between your teeth. That is basically damaging your gums, causing gum recession. It won't make your teeth whiter unless there is so much stains on your teeth, especially those black stains that can be from smoking. Then yes, it looks like it's whiter, but it hasn't done whitening. The whitening is different. Whitening is a hydrogen peroxide gel that goes on the surface of your teeth, dissolves the color on the surface, and leaves your enamel whiter than before. Whitening and cleaning are completely different procedures.
So total so far is 1.5. So we can
That's
record
it.
another one as well.
Okay.
We are moving on to the next video. The beginning of the stuff.
All right, these two. Okay, next one. Do children need dental cleaning? I would say yes. Yeah, the short answer is yes. But how often is so different from adults? We would usually, depending on how old your child is, for example, if they are 3, no, there's no cleaning needed. We have a look, we make sure that your oral hygiene is good, their oral hygiene is good, you're teaching them correctly, you're doing it with them, stuff like that. Of course, if there's a cavity, either we monitor or have to fill it. But when they get older, especially when they're teenagers, they're now gonna start eating worse. And they're gonna be more slack in cleaning their teeth because they're teenagers usually. So in these cases, they do need dental cleaning, but how extensive the clean, how often, all of this depends on what's going on in the mouth. For example, for some, I only need to polish with a brush and a bit of prophy paste and it gets rid of all the plaque. For some, we need to actually do a dental scaling and cleaning because they have a lot of buildup in calculus. We cannot compare one with the other, but what's obvious is that your child needs to see a dentist also every 6 months. Not only to take care of their oral health, but also to establish this habit of going to the dentist regularly. Dentist is not a scary place, and I don't know why I said and what?
You're not scared.
And they grow up with better teeth. Alright. What's the difference between a regular cleaning and deep cleaning? How long was that?
1.5. Ready?
What is the difference between regular dental cleaning and deep cleaning? Not everyone needs a deep clean. If you have healthy gums, you would just need a scaling and cleaning every now and then to make sure you maintain the healthy gums. If due to any reason you have gum disease or gum and bone disease, which is called periodontitis, you want to see a periodontist who's a gum specialist. In that case, you might be recommended to do a deep clean because there are because there is so much buildup attached to the root surface of your teeth. It's not only above the gum anymore. There are like barnacles attached to basically your roots that we have to clean the roots. It's called root planing. Once the surface of the root is smooth and clean, there is much less bacteria there. The gum can reattach and hopefully heal itself if it's not too late. Hello?
Amen.
Okay. Good. Can you get dental cleaning if you are pregnant? Pregnancy can cause inflammation in the body, especially in your gums. You probably will get more bleeding gums. There is something called a pregnancy tumor, which is not at all dangerous, and it will go away. But all of these changes will happen because you're pregnant. And yes, a dental cleaning is such a good idea because it will clean your teeth, reduce the inflammation. Another thing that I would recommend is use warm salt water as a mouthwash because again, it can disinfect and reduce the amount of inflammation. Once the baby is born, the inflammation starts reducing, you should see an improvement in your gum health and there should be no more bleeding gums. If there is, talk to your dental professional. How long?
45.
Together?
No, this one. So far, one. That's. We need to add another minute.
Okay. Okay, there's some weird questions. Like, can I schedule a dental cleaning if I have a cold and flu?
So you should stay home.
That's just, I hope that's just common sense. That to stay home.
I hope that's not FAQ.
Huh?
I hope that's not FAQ. You know.
No, I hope so not. Especially after COVID. It's so obvious. Mm. Can you undergo dental cleaning if you have sensitive teeth? This is a common problem. People with a lot of sensitivity don't want to get a dental clean done because of the water and the vibration makes them feel uncomfortable and more sensitive. You still need a dental clean because just because your teeth are sensitive, it doesn't mean that there are no buildup or calculus or tartar in between them. If anything, you need it more than other people because if you get more and more gum recession due to the fact that you're not doing a dental clean, you will have more sensitivity. Why? Gum, imagine, gum is right here, right? That's the tooth, that's the gum. The gum keeps going down, down, down because the buildup is pushing it down. This area gets naked and cold and sensitive. So you don't want to skip on your cleaning. Now, how can you help it? First of all, talk to your dental professional. There are a special toothpaste they can prescribe for you to use a couple of weeks before you come to desensitize your teeth. They can, worst case scenario, numb you. Use numbing gels, use warm water if they can. Sometimes we can, change the water if it's not connected to the tap. Or they can go slowly, slowly. Even sometimes we can only use manual cleaning, which again, is not possible as much because we usually need to use a combination of the machine and the manual. But as I explained, skipping your dental cleaning is not an option. Worst case scenario, ask for a numbing injection, be fully numb, but get the teeth clean because if you leave it be, it's going to worsen the situation with your gums and the sensitivity. Happy?
Yeah.
Okay. Oh my God, oh my God.
That's all good.
Okay, that's all the clean. So we did 4 now. And guys, I'm gonna check on the comments, but I'm gonna go soon and leave something, you know, for you to watch later. Otherwise, I'll spoil all the videos. All right. All right, guys, we're gonna take a break. Thank you so much for watching. This was amazing. Most of the world is asleep, but here in Melbourne, it's, you know, morning time because we are in the end of the world, literally. Beside New Zealand, I guess. I'll see you at the next one, but I try to do more slides. If you have any questions, comment, like, subscribe, and I'm gonna see you at the next one.